Hi, good day, doctor. My name is Lim Jin Shen, and I'm Year 5, Group 3, supervised by Dr. Khairul Asnan for my orthodontic case presentation. So the patient's details is as below. Her name is Tuan Maizatul Akmal binti Tuan Kamarud, who is a 34 years old female, came with a chief complaint of gigi atas dan bawah ada gap. And these are the extraoral photos, which consist of the frontal view and the side views. For skeletal assessment, antero-posteriorly, this patient has a class 1 skeletal pattern, which provides a straight facial profile, while for vertical assessment, this patient has a moderate Frankfurt mandibular plane angle, which is shown by the red and blue line in the slide. Yeah. And this patient has slightly increased lower anterior facial height. Transversely, this patient has grossly symmetrical face and she has competent lip at rest. So these are the intraoral photos. So for intraoral examination, patient has fair oral hygiene and minimal plaque could be visualized. For oral mucosa, there is no abnormalities detected. While for gingiva, it could be seen that there is reddish gingival margin and the interdental papilla is blunt due to spacing. So for teeth charting, this patient has all the teeth present except for clinically missing 2-5. For lower arch, this patient has a U-shaped lower arch. For labial segment, there is a mouth spacing of approximately 3 mm, which could be noticed from 3.3 to 4.3, and it could be also noticed that 3.1 is rotated mesiolingually, while for buccal segment, it is generally well aligned. While for upper arch, it is also U-shaped. For labial segment, 1.1 and 2.1 are rotated mesiopalatally, and there is a median diastema of approximately 1 mm. While for buccal segment, there is a missing 2.5, so I would say that there is a moderate spacing of approximately 7 mm. For labial segment relationship, this patient has a class 3 incisor relationship where edge to edge could be seen. That's a reverse overjet of 0.5 mm and crossbite of 1.1 and 2.1. While for buccal segment relationship, from the intraoral pictures, it could be seen that canine relationship on the right side is class 1, while on the left side it is class 2 quarter unit. For molar relationship at the right is class 1, while at the left is class 1 as well. However, for study model analysis, it could be seen that actually the canine relationship at the right side is class 2 quarter unit, on the left side as well class 2 quarter unit, while for molar relationship on the right side is class 1 unit, is class 1, and on the left side it is class 2 quarter unit. So the IOTN for this patient would be 4H, which is less extensive hypodontia requiring preoperative orthodontics or orthodontic space closure to obviate the need of a prosthesis. And OPG was taken for this patient on the 2nd of March on 2016 All the permanent teeth from 8 to 8 are present except tooth 5, and there's a radial opacity on distal surface of tooth 4 which indicates restoration. And cephalometric analysis was done. So after the analyze from the lateral calf, the SNA is 86, which is more than the normal values. This indicates that the maxilla is pronatic in relation to cranial base. For SNB, it is 84 degree, which is also more than the normal values. And this indicates that the mandible is pronatic in relation to cranial base. So for A and B, it is 2. And since it is within 2 to 4 degree, it indicates that this patient has a class 1 skeletal pattern through lateral calf. For SNMXP, the angle is 7 degree, and since the value is within 5 to 11, A and B correction can be applied, and the corrected one is negative 0.5 degree. For the maxillary mandibular plane angle MMPA, the value is 19, and it shows that the inclination of maxilla in relation to the mandible is more acute than normal value. For upper incisor to maxillary plane angle UIMXP, the value is 112 degree, and this indicates that the upper incisor long axis angulation in relation to maxillary plane is within normal range. While for lower incisor to mandibular plane angle, which is LIMNP, the value is 104 degree, and this indicates that the lower incisor long axis angulation is in relation to mandibular plane is increased. This indicates that the lower central incisors are proclined. While for the inter-incisor angle, it is 126 degree, and it is actually within normal range. While for lower anterior facial height ratio, it is 58.6%. This indicates that the patient has increased lower anterior facial height. So for summary, patient is a 34-year-old Malay female with chief complaint of gigi atas dan bawah ada gap. She presented with a class 3 malocclusion on class 1 skeletal pattern with increased lower anterior facial height. On lower labial segment, 3-1 is rotated mesiolingually and there is mild spacing. On the upper segment, tooth 1-1 and 2-1 is rotated mesiopalatally and tooth 2-5 is clinically missing. In occlusion, she has reverse overjet of 0.5 mm and crossbite at tooth 1-1 and 2-1. The canine relationship on the right and left is class 2 quarter unit, while molar relationship on the left is class 2 quarter unit. The etiology would be tooth arch size discrepancy, as the jaw could be big and the tooth is small, and this actually caused the spacing in between her teeth for both upper and lower arch. So the problem list would be mild spacing of lower labial segment, mild spacing of upper labial segment, moderate spacing of upper buccal segment, rotated 1-1 and 2-1 mesiopalatally, and rotated 3-1 mesiolingually, reverse overjet of 0.5 mm, crossbite of 1-1 and 2-1, class 2 quarter unit canine relationship on the left and right side, as well as class 2 quarter unit molar relationship on the left side. The aims of the treatment would be to close the spacing of lower and upper labial segment, to close the spacing of upper buccal segment, to correct the rotated 1-1, 2-1 and 3-1, to increase overjet, to correct crossbite, and to correct the canine and molar relationship. Treatment plan for this patient would be providing oral hygiene instruction and education, upper fixed appliance as the space is too big to be closed by removable appliance, and for lower arch it will be lower removable appliance with labelable and Adams clasps, while for retention phase it will be Hawley retainer, which consists of a labelable and two Adams clasps at molar. So this is the design for the lower removable appliance. So it consists of a labelable from teeth 33 to 43, a Z spring at lingual of tooth 31, Adams clasp at teeth 36 and 46, and the base is acrylic base plate. So to justify the design, labelable is to retract canine to canine inwards and close up the spacing in between, while Z spring is to correct the rotated 3-1. Since 3-1 is rotated mesiolingually, hence I think the Z spring would be placed mesial to the 3-1 to push it out to make the alignment correct. And Adams clasp is to provide retention for the whole removable appliance.